ATI Chapter 14, Neurologic Disorders. Head injuries are classified as open or closed. In an open head injury, the integrity of the skull is compromised by either a penetrating object or a blunt force trauma. A closed head injury occurs from blunt trauma that causes acceleration of the head and then deceleration or hits a stationary object. Head injuries are also classified as mild, moderate, or severe, depending on the Glasgow Coma Scale ratings and the length of time that the client was unconscious. Types of brain injury include concussion, contusion, diffuse axonal injury, and intracranial hemorrhage. A concussion or mild traumatic brain injury occurs after head trauma that results in a change in the client's neurologic function, but no identified brain damage, and usually resolves within 72 hours. Post-concussion syndrome includes persistence of cognitive and physical manifestations for an unknown period of time. A contusion occurs when the brain is bruised and the client has a period of unconsciousness associated with stupor or confusion. Diffuse axonal injury is a widespread injury to the brain that results in coma and is seen in severe head trauma. Intracranial hemorrhage can occur in the epidural, subdural, or intracerebral space. It is a collection of blood following head trauma. There can be a delay of weeks to months in presenting manifestations for a subacute or chronic subdural hematoma. Open head injuries pose a high risk for infection. Scalp injuries often result in profuse bleeding due to the poor vasoconstriction of the blood vessels of the scalp. Skull fractures can occur following forceful head injury. The brain might be damaged as the result. The client can have a localized pain at site of fracture and swelling can occur. The nurse should be alert for drainage from ears or eyes, cerebral spinal fluid, CSF. A cervical spine injury should always be suspected with a head injury when it occurs. A cervical spine injury must be ruled out prior to removing any devices used to stabilize the cervical spine. Health promotion and disease prevention. Wear helmets when skateboarding, riding a bike or motorcycle, skiing, and playing football or any other sport that could cause a head injury. Wear seat belts when driving or riding in a car. Avoid dangerous activities such as speeding, driving under the influence of alcohol or drugs. Owners of firearms should lock all firearms. Avoid riding in the back of a pickup truck. Promote programs directed at older adults to prevent falls, which are a major cause of neurologic injury in adults ages 65 to 75. Older adults who sustain head injuries are at greater risk for complications, hematomas, due to increased adherence of dura mater to skull and because of higher rates of anticoagulants prescribed to the older population. Assessment with the head injury, brain injury, would be to look at the risk factors: motor vehicle or motorcycle crashes, illicit drug and alcohol use, sports injuries, assault, gunshot wounds, and falls. Expected findings would be amnesia, loss of memory before or after the injury, loss of consciousness, length of stay, or length of time the client is unconscious is significant. CSF, cerebrospinal fluid, leakage from the nose and ears can indicate a basilar skull fracture. Test for the halo sign, clear or yellow tinted ring surrounding a drop of blood when bloody drainage is placed on a piece of gauze. This could indicate the CSF. Manifestations of increased intracranial pressure: severe headache, nausea, vomiting, deteriorating level of consciousness, restlessness, irritability, dilated or pinpoint non-reactive pupils, cranial nerve dysfunction, alteration in breathing patterns such as kinesiokes, respirations, central neurogenic hyperventilation, apnea, deterioration in motor function such as abnormal posturing, decerebrate, decorticate, and plasticity. Cushing's triad, a late finding characterized by severe hypertension with a widening pulse pressure, systolic minus diastolic is the pulse pressure, and bradycardia. And seizures are expected findings with the head injury. This completes page 81. Moving on to page 82 in chapter 14 is laboratory tests. Would be ABG, CBC with differential, blood glucose level, electrolyte levels, blood and urine osmolarity, toxicology screen, and monitor anti-seizure medication blood levels. Diagnostic procedures would include a cervical spine film to diagnose a cervical spine injury, computerized tomography, CT, and or magnetic resonance imaging, MRI, of the head, and or neck with and without contrast if indicated, calculation of cerebral perfusion using the ICP monitor if it is in place. Patient-centered care. Nursing care would be to support the family following a head injury is of great importance. Effective coping can be very difficult to achieve without support from providers and community members. The Brain Injury Association of America provides families and clients with information needed to cope with this potentially devastating injury. The family can face difficult decisions following head injury. If brain death has occurred, the family needs support when deciding whether to donate organs. Maintain a cervical spine stability until cleared by an x-ray. Report presence of CSF from nose or ears to the provider. Determine whether the client could possibly be under the influence of alcohol, illicit drugs, or medications, which could impair neurologic responsiveness and affect the monitoring. Implement measures to prevent complications of immobility. Turn every 2 hours. Footboard and splints. Specialty beds can be used. Monitor fluid and electrolyte values and osmolarity to detect changes in sodium regulation. Onset of diabetes insipidus or severe hypovolemia. Provide adequate fluids to maintain cerebral perfusion and to minimize cerebral edema. When a large amount of IV fluids are prescribed, monitor the excess fluid volume, which could increase ICP, intracranial pressure. Maintain safety and seizure precautions with the side rails up, padded side rails, and call light within the client's reach. Even if the level of consciousness is decreased, explain to the client the actions being taken and why. Hearing is the last sense to be affected by a head injury. Assess, monitor the client at regular scheduled intervals. Respiratory status, the priority assessment, is important. The brain is dependent upon oxygen and to maintain function has little reserve available if oxygen is deprived. Untreated hypoxia leads to brain injury or death if the brain has been denied adequate oxygen for 3 to 5 minutes. Changes in level of consciousness using the Glasgow Coma Scale GCS provides the earliest indication of neurologic deterioration. Cranial nerve function, which would be eye blink response, gag reflex, and tongue and shoulder movement. Assess pupils for size, equality, and reaction to light. Pupils that are equal, round, and reactive to light and accommodation, PERLA, PERRLA, are a normal finding. Bilateral sensory and motor responses. This completes page 82 of chapter 14 ATI.